From a doctor's point of view, does it work?
So, first thing to say is it appears to be safe. So that's the first thing I would be concerned about as a doctor. And from what I've seen, it does work for cosmetic appearance. It does work for some tightening. So, you know, if that's going to improve your sex life, make you feel happier, fine. Whether it works for these claimed medical reasons, such as incontinence and prolapse, there's yet to be enough research. But I think if they do prove, and there's good evidence and there's good research to show that, then as an alternative to surgical procedures, this would be a good thing and potentially be available on the NHS. But I think we're a long way away from that. And for the time being, there are lots of treatments available for all of those conditions on the NHS.
All right, thank you, Zoe. Right, OK, Holly?
Yeah, well, we're joined now by a very brave volunteer who has agreed to try out this procedure. So I'm going to get Dr. Shirin. Welcome. Very nice to see you. You can start the procedure. I'm going to start off with Annie and ask why are you doing this today? What was it you were unhappy with?
Well, as I've got a little bit older, I'm now 37, I've noticed that skin in all areas of my body, the elasticity of it's just not the same. So it's more for prevention, tightening up my pelvic floor as well.
OK, but it's not aesthetic. It's not that you look at it and go, oh, that doesn't look...
Oh, no. No, I'm quite happy. Like I say, 10 years ago, I wouldn't even think
dreamt
about
of doing it.
But it's more maintenance, you know, it's the same as...
Any part of your body, I guess. Really brave. I mean, more women seem to be talking about this than ever before, which is a big forward step.
Yeah, I think actually, Holly, the problem is that not enough women are talking about the issues they're having with their vaginas in general, problems like stress, incontinence and laxity and lack of confidence as your body changes. More and more women are coming forward when they find out that treatments like this are available that are safe, non-invasive and effective.
Well, we should talk about what's going on now. There's a lot of bibbing going on. I can see. So what are you doing? We saw the probe.
Yeah,
do you call it that?
We call it a probe.
OK, we saw the probe. Dr. Zoe had that, so we know that's now inside you.
Yes.
And what are you doing?
So I'm moving it backwards and forwards inside the vaginal canal. And there is a little band on the probe, which is where the radio frequency is emitted from.
And it heats up?
It generates radio frequency waves, which does heat up the tissue inside.
So what does it feel like? Does it feel warm?
Yeah, it feels kind of like if you've been for a hot stone massage, that hot stone feeling.
But it's not uncomfortable?
Not at all.
So no pain?
No.
And how long do you have to do this for?
The internal treatment takes 8 minutes.
Oh, so it's really quick.
So it's really quick. And you can do the external treatment as well, which helps with the vulva, the labia.
Oh, OK.
So that's the one that also helps with the cosmetic appearance.
And how long does that take to do the outside?
About 20 minutes.
And it's a treatment of how many?
Up to 4, depending on how severe the condition is.
Up to 4. And what's the cost? Is it pretty pricey?
For the full treatments, you're looking at around £1,200 in this part.
And is that it done, or do you have to come back and top up?
Usually, because you can't stop the body from ageing, unfortunately, there are maintenance treatments needed, but that's usually what...
You've had the treatment, we're all done. This is the big reveal, so you're going to have a look to see if you can notice the difference yourself. This was something that it was prevention, sort of as you're getting older, you'd notice the change.
Yeah, to tighten the muscles up.
Tighten everything up.
Yeah.
And a little bit of the labia was on the outside. You wanted to bring that in a bit.
Yeah.
There's your mirror. We're going to obviously let you have a look, and we're not going to see anything. You did just very kindly show me your before pictures on your phone, which took me by surprise. So what can you see a big difference?
I'll be honest, I wasn't expecting the Ultrafem to do that much in such little time, but it's really tight and firm.
It really changed. Does it feel different?
It does feel just like firm and tighter.
I have to say, and I wasn't expecting